Let's get more now. We can speak to Dr. Victoria Rose, who is a British doctor who is just back from her third humanitarian mission to Gaza. Dr. Rose, thank you very much indeed for your time today.
Pleasure.
You are a consultant in plastic and reconstructive surgery, and I gather you worked, non-stop more or less the time you were in Gaza. Just talk us through what your day-to-day reality was when you were there.
Well, we would start operating at about 8 o'clock in the morning, and we would have a list downstairs in one of the big NGO-run buildings. We would run a plastic surgery list and next to it an orthopedic list. And the idea was that we would cross-cover any orthopedic injuries that had skin loss or skin issues. We would do those as well, and then we would have our own list. We'd have about 10 patients on the plastics list, 10 patients on the orthopedic list, and then we would run a sedation room of dressing changes, and that would have another 5 patients on it. At the same time, we'd have to be available to the main theatre suite, which was upstairs, and it was a block of 5 theatres, and that's where general surgery, neurosurgery, vascular surgery would undertake their work. And if they came across any patients that had large areas of soft tissue loss or burns or needed amputations, then they would call us and we would go up and help them with those cases as well. So it's a really quite a busy day. We're operating on up to 25 patients a day. And we would normally try and finish all the planned work by about 10 o'clock at night. And then we would go back to the accommodation area, which was within the hospital. We would normally eat. We would discuss the plans for the next day. I would put in the following day's operating list, and then we would submit all our numbers of our activity for the day to the WHO and then go to bed. We would be called in the night for any mass casualty events that required urgent plastic surgery. So that would normally be limb-threatening injuries. That tended to happen more towards the end of our trip because we started to see more mass casualties then as NASA got further into the active fighting zone.
And how long did you maintain that routine for?
Every day for just over 3 weeks.
Okay, and did you feel, you mentioned mass casualty events happening in the vicinity. Did you feel at any stage that your life was in danger?
Yes, I was worried the first day we arrived because we were due to go to the European Gaza hospital. So when we entered Gaza, that was where our vehicle was taking us. Our charity had 2 groups go in. So I was a group with 3 surgeons, and the week before me, a group of 2 surgeons had gone in. One that I know very well, he's an old friend, and they had gone straight to the European Gaza. And as we arrived, the European Gaza got bombed. And so he was sending me footage of an explosion outside the hospital. And at that point, I was quite worried for his life, really, and the life of my other colleague. But I did sort of worry that hospital bombing was getting more and more acceptable, I suppose, and that we would be in danger.
You've described your daily reality. Now tell us what the daily reality for the average person in Gaza is, as far as you were able to see from where you were.
So obviously I'm mixing mainly with Palestinian doctors and nurses. They've all been displaced, many of them up to 15 times now. Lots of them are living in tents. There's not many structural buildings left in South Gaza. There's no sanitation in any of these tented facilities. There's very little clean water left. Clean water now is only available in areas like large hospitals that have their own filtration systems. Most of the other buildings have been destroyed. So clean water is one of the things that people worry about. And a lot of people spend their time trying to obtain clean water and food. Obviously, the blockade to aid was fairly maximal when we got there. Nothing had come in since the 2nd of March. And although we were in Gaza when the first 90 trucks got in, it didn't really seem as if much aid had come through. Everybody was still spending a lot of their time sourcing food. The level of malnutrition was visible in the population. I mean, it's a dire life, really. When I spoke to my colleagues this time, more than one said that they would rather die than carry on living like this.
And you said malnutrition was visible. Could you just try to help us understand? Because we're told sometimes by the authorities in Israel that reports of malnutrition, reports of starvation are wildly exaggerated. Help us make sense of this. What did you see? I mean, what's the evidence, and what would be some of the definitions you could use to help us to really get a true picture of the situation?
Well, everybody that I'd met before, because obviously I've been to Gaza before the war, everybody I knew that came to see us or that we were working with has lost weight, and it's very visible weight loss, so 5-10 kilos. But we noticed it really in the children. The children are hit the hardest because the under fives particularly have a very high metabolic rate because they're growing. And what I noticed most was that the children are very small for their age in comparison to their Western counterparts. So a child that would go on the operating table, I would estimate to be 5 years old, I would be told that they were 9 or 10. And that was quite shocking. They're very small. There's definite fat loss and muscle wasting to see in the children. The other thing that we noticed is their immune system's definitely been suppressed. And that's one of the first things to go in malnutrition. You just don't have that cell turnover to fight off infection or repair, really. You need those essential nutrients and vitamins for cell restoration. And we saw a lot of children that would have stabilized or made some sign of recovery when we were in Gaza in March, but this time you were cleaning, debriding and dressing wounds, and then when you brought them back to do the reconstruction, there was signs of infection, more dead tissue, nothing was recovering. And that's quite hard to deal with because we also had a lack of antibiotics. We only had 3 types of antibiotics left. We had meropenem, gentamicin and a cephalosporin, and those 3 are not really first-line antibiotics for dirty wounds like this. We would normally in the UK use a broad-spectrum penicillin, but we'd run out of that. So coupled with that depressed level of healing and immunity, you've got no pharmaceutical aids to help the situation. So we saw a lot of children who possibly would have had treatable or more salvageable injuries, and we couldn't really do much other than amputate.
We're also told, I mean, in addition to what sounds like an acute shortage of antibiotics, that operations are sometimes having to be conducted without correct anesthesia, without the right tools. Were you allowed to bring anything with you? Because I'm sure you had to pass by Israel in order to get there. Were you allowed to bring supplies, knowing as you did from having worked there on the ground, what sorts of medications, what sorts of tools might be most in need?
Well, the charity doesn't have a license to carry medicines, so we've never attempted to get medicines in. The rules from COGAT, who are the coordination of activities in the occupied Palestinian territories, are that the emergency medical teams can only bring 1 bag with them, and that bag can't be more than 23 kilograms. And it's suggested that you don't bring any kit in that bag. You're limited to the number of mobile phones, computers, cigarettes, any of those items that could be sold. You're not to bring in multiples, but they do ask you not to bring in kit as well. However, I've never had any kit taken off of me. I've not bought in huge quantities, but this time I bought a skin grafting set and I bought some instruments. I bought probably 2 full sets of, scissors and forceps because I knew that NASA didn't have them, or we knew that the European Gaza didn't have them, which was where we were supposed to go, but NASA didn't have them either. And they were distributed amongst mine and my colleagues' belongings in a way that looked as if they weren't huge quantities. But none of our bags got opened. Well, if they got opened, nothing got taken. So we did get quite a lot in, but there is always that fear that you won't. And there are stories that people have had things taken off them, but that certainly didn't happen to us.
Is there one image or one scene from your time in Gaza? You say you were there around 3 weeks, that you're just never going to be able to erase from your mind, whether it's from this latest trip or one of the previous trips? Or perhaps there was one encounter with one individual that perhaps struck you more than all the others?
There's been lots, really, to be honest, but it's the children more than anything. And it's normally the children with life-changing injuries who you then find out have lost all of their relatives, so they've been orphaned as well. I think one of the hardest things for me was a 7-year-old girl that came in, had been blown up, and she had lost a section of her knee. So she'd lost the bone from her knee to her shin, and that was missing, as was all the skin overlying it. And the muscles that should have been there were gone. And when she was brought in, when you lose something like that in the UK, if you amputate a bit of you, when you're brought into hospital, they always bring the part with you, and there's an attempt to replant that part. And this was quite offsetting, that she'd come in and that part of her body was completely missing. And anatomically, it's very odd to look at a wound like that. And she was one of the patients that was definitely suffering from malnutrition. And when we did the first operation to clean her leg and dress it, I was fairly confident that we'd made some ground and that when we got her back, we would be able to reconstruct her. But by the time we got her back 48 hours later, and the wound was infected and there was more dead tissue in, and she had to undergo another debridement, so removal of that dead infected tissue. And by the 4th time we brought her back to the operating room, it was clear that we were going to have to amputate her leg, and that we were going to have to amputate her leg above the knee. And I think that was quite hard, because the initial injury, we had such a good plan to reconstruct her, but she just wasn't healing. She succumbed to infection. It was just impossible to carry out the initial plan. And for a 7-year-old to have an above knee amputation is just devastational, really. I mean, the word life-changing doesn't cover it. And she'd been orphaned in the blast as well.
A horrific story there. I mean, I assume you follow, now that you're back in the UK, what's happening in Gaza, and perhaps you avoid them, but when you watch news channels, what bothers you most about what you know to be the reality on the ground, and how it's covered and how it's portrayed by the media and by officials on either side?
I think it's very difficult, and I have to sort of concentrate on the humanitarian side of it. I mean, I'm not playing down what happened on October the 7th, and a lot of women and children were taken hostage in that event. But the collateral damage from this attack on Hamas is quite shocking. The number of children that are being injured and cited as, we're not attacking children, we're after a terrorist organization. But it's a vast number of children that have been maimed, killed, orphaned, really huge numbers. And every time I've been, the number of children affected is rising. this time, 60% of my operating list every day was under the age of 15. And I'm operating on, 13 people every day. So it just gives you an example of what I'm seeing. And it's very difficult to fully accept that it's a targeted attack on Hamas terrorists.
And when you compare coverage of Gaza to, say, coverage of Ukraine, where there's tragedy every day and children, women, men maimed every day, do you get the impression there's a bit of a double standard when it comes to covering suffering according to who's actually the one suffering? Do you detect that?
I think what's the hardest is to work out what news is fake and what is not, because I think whatever comes out seems to be cited as fake. And I know a lot of the Western media say that they can't get in and they can't, verify what's coming out of Gaza. But there are quite a few Palestinian photographers and filmmakers that are putting their footage out. But it is constantly being disbelieved and cited as fake. Just as in, a lot of the comments that Israel make are being, lots of the comments about the initial October the 7th were cited as fake. And I just think we've got a very muddy picture of what's going on. And all I can say is what I saw. And I saw a lot of young children with very devastating wounds.
Okay, and Dr. Rose, I mean, given that there is a discrepancy, it would appear, between what you saw and what we as a news channel and other news channels get told, for example, by the Israeli government. Let me put some quick statements to you, and I'd like to get your reaction to them. And you can tell me in a couple of words whether or not those statements hold any water. So one thing we're repeatedly told is that hospitals are hotbeds for Hamas. They're used as command centers by militants. Did you see any evidence to support that?
Not this time. Not any time I've been there. I mean, I've been to the European Gaza and NASA twice, and over the course of 2024 and into 2025, I haven't seen any Hamas soldiers in those hospitals when I've been there. I haven't actually seen anyone in military uniform or anyone carrying a gun, but I don't know what Hamas looks like, I suppose, would be the answer to that. And maybe they were there and I didn't see them, but I didn't see anyone militarized.
All right, we're told hospitals are used as a cover for a labyrinth of tunnels used by militants. Did you see any tunnels, or were there any areas of the hospital people said, "Oh, I wouldn't go there if I were you"?
No, I didn't see any tunnels, but then I have seen footage of tunnels. So all I can say is what I saw. I didn't see any tunnels at NASA, and in the march, I didn't see any tunnels at the European Gaza. But I spend most of my time in the operating theatre or walking between the accommodation and the operating theatre. I was quite surprised by the footage from the European Gaza to see that there were tunnels under the front entrance, particularly because I walked across that every day, and that was completely unnoticed by me.
Okay, we're told that the majority of the 54,927 people killed, which is the latest local official death toll, although that might be disputed by Israel, we're told the majority were Hamas militants. Does that sort of ring true to you?
Well, as I said, I think half of them are children. At least half of them are children. So unless they're recruiting children, I would say I can't follow that statistic, really. Half of the people I treated were children, so I can't follow that statistic.
Okay, and we're told repeatedly no one is dying of starvation. The reports of malnutrition are wildly exaggerated. People have enough to eat. How would you respond to that?
I don't think that's true. Certainly not from what we saw on this mission. Nobody's got enough to eat, and there were definitely signs of malnutrition. 60 children died at NASA from malnutrition while we were there. Admittedly, a lot of those are children that are gluten intolerant and can't take standard formula milk, or children with other metabolic illnesses that they can't treat because of the lack of supplies. But there's definitely signs of malnutrition at NASA at the moment, and for the entirety of the month we were there.
I know you're a doctor, you're not a political figure, so please feel free to disregard this next question. But does the word genocide ring true to you as being a word that could be apt to describe the situation in Gaza right now?
I thought so, but I understand that the definition possibly isn't what I think it is. So it's probably not for me to be drawn in it. But there's a huge number of people dying in Gaza at the moment that needlessly as collateral damage for this war. And I'm not sure how long we can watch that happen from a humanitarian point of view.
And were you to get 30 seconds with the British Prime Minister, Sir Keir Starmer, what message would you want to get across to him?
I think this is becoming very partisan now. I think we have to be very careful of the way that we go forward. I think that this is not going to end well if it continues. I'm concerned about the number of children that have been orphaned, and the videos that I've seen of small children, who've lost a parent, screaming and ranting at the camera. I worry what those children will grow up into. There is definitely a rise in anti-Semitic behaviour, particularly in the USA. I don't think we can just let this carry on the way that this war is being run. It's not going to end well for anyone, and I would urge my government to look very carefully at measures that they can immediately take to bring a stop to it.
Just talking about you as we wrap up, how does it feel to be back, and how are you processing everything you've seen and reconciling that with your vastly different daily reality now that you're back in the UK?
I'm sort of still in it, really, because I'm still in conversation with my colleagues in Gaza. We still have patients that we've operated on that I'm being updated on. I'm still watching NASA in the red zone. I said tomorrow I will watch the MSF NGO evacuate NASA, which is possibly the beginning of the end for it. So I don't feel that I'm in a position to step out and process it. I think if this war, if we do get a ceasefire, what I've seen might possibly be worth it, and I'll feel that, we've accomplished something. But as I say, I'm concerned about the future for both sides if we don't stop.
Just in a word, would you go back?
I would love to go back. I'd quite like to go back when it's all over, just to see people that we've been working with, and not necessarily work the way in which I've been working. I would like to go back, but at the moment I don't think I will be allowed back in. I don't think I will get permission to enter Gaza again, okay. And until the situation changes.
All right, we're going to have to leave it there. We're out of time. Thank you so much for taking the time to speak to us. We really appreciate it. Dr. Victoria Rose, thank you very much indeed.
Thanks very much.